supplies that you'll need. I like to start by opening everything. This is a J-loop or an extension tubing. You'll open the saline flush and get the air out of it. Connect, twist, and push, and then you'll flush it. I go ahead and take this cap off, keeping this sterile. Flush, and then put your tip in the plastic protector. So this is ready for you. Also get my tape ready. They're teaching us now to put it on your hand, make a little bridge. This way you can gather it and attach it instead of connecting it to a side table. And take another maybe 4-inch strip and I split that in half. So I have one thick piece and 2 thin pieces. I am right-handed, so I'm gonna put it on my left hand. Like that. I have my Tegaderm ready to protect my site and my tourniquet. So you're gonna want to attach the tourniquet right above where you want to access the vein. So if there's a vein on the lower limb, you're gonna tie the tourniquet down low. So you go under the arm, cross over with a medium pull, and then just tuck it. You won't tie it because you want a quick release. You don't want it too loose, but you also don't want it too tight where it's hurting. It is painful after some time. So quick release, practice tying tourniquets on classmates or on a family member, making sure you don't leave it on too long, but kind of feel around, feeling for a vein. So I'm gonna tie this tourniquet to the right AC, which is the antecubital, tucking it, and I'm gonna start feeling around. I like to kind of close my eyes and feel a bouncy vein. It's kind of full. I ask the patient to make a fist and kind of pump it. Also, once you get your alcohol, this will kind of help the veins pop up a little bit. So I just kind of clean it, and then I feel like I have about a 2-inch straight stretch here. You want to follow the vein once you go in. So if the vein is from here to here, you're gonna go in with your needle at an angle, drop it, advance the needle, and then you're gonna advance the catheter. So you want some space, and you wanna be able to know where you're going with it. That's why feeling it is so important. So once you've cleaned it, take your fingernail and kind of make a little indentation so you can see. Clean it one more time, and then you have a little visual so you don't have to touch it again. So you're going to open your catheter like this. You don't want to pull too hard because then you could stab yourself. So you'll just open it. This kind of spins around, so you want to make sure your bevel is up, which is the little hole. And then it's in line with the white button that just retracts the needle. There's 2 indentions on each side of the white button. So you'll hold it here. Then you'll take it and kind of put it in your palm. And that secures it. That way you're not going in like this. So put in your palm, I can see where I've made my mark. I'm gonna take my left hand and pull back just a little bit with my pointer and my thumb, just to kind of make the skin taut a little bit. And then I'm gonna use these 3 fingers to kind of secure, like so I have a strong base to kind of lean on. So I'm gonna go in at an angle. Did you see the flash? Okay, so I'm in. I don't want to go in anymore because I'll go through the vein. So at this point, I drop it, advance the needle, then advance just my left hand with the catheter. Apply the pressure here. I'm not going to push down hard right here. I'm going to kind of push right here, and then I'm going to retract. I'm going to meet the green and the blue, pop my tourniquet, then I'm going to hold this blue and I'm going to tighten the green. Hold the blue still and tighten the green. You do not want to spin it. You hold this and tighten this. So do not take your hand off of this until it's taped. So I'm going to take my big piece and just lightly tape it right at the hub. I'm not going to cover it up right here on the tip because I don't want the sticky getting right there and I don't want to contaminate that. So now that it's taped, I'm gonna flush it, pull back a little bit, I got return, and then I'm gonna flush and lock. So that's a saline lock. Disconnect. Then I'm gonna take this small piece, sticky side up. Now I can let it go because it's taped. I'm gonna go sticky side up and butterfly technique this. Now my IV is very secure and it's not likely gonna come out. If it leaks, pull the tape back using a little alcohol, peel it back, and then just make sure this connection is tight before you remove it, if you have a complication. So here is the Tegaderm. I'm gonna place that right over the tip because this is what I am assessing, this area right here. So once you have that on, you can peel back. And then you'll save your last piece to just tape the whatever's left. There. And I usually like to put tape on tape, especially for elderly people. You can peel their skin off when you remove the tape. So I try to just put tape on top of tape. Also, you're gonna put the date, the time, and your initials on this little piece that peels off. And then you'll wanna put that on the side. Again, tape on tape. I would not put it over here because you wanna be able to see. So I put it on the side. And that should be it for the IV start. I just wanted you to have that technique down pat. I know you can watch Tiffany's video as well as this one just to practice the steps and know that you can't really harm anyone starting an IV. It's gonna hurt, it's gonna be a big stick, but you're in control. Once you insert and enter the vein and you get the flashback, you can stop inserting deeply. You just lower that catheter and advance just a ½ inch and then advance the catheter off of the tip. So the needle is not in here anymore. The catheter is about this long, so it's here. The needle has been retracted into this, and this goes into the sharps container. So the patients can bend their arm to eat, but if they're having continuous IV fluids and they're bending their arms, it's gonna beep and say vein occluded. So try, if you can, to use a non-dominant hand or whatever hand that they prefer, or some people will tell you where they have good veins. Look on the right side and then also look on the left side before you make the decision, because you know, you don't have to go with the first arm that you check for. And then make sure that you're cleaning up once you're done and throwing away all of your trash. And that's it. Good luck.